The following video contains themes of mental ill health and suicide. Rural communities like Melbourne in the southwest of New South Wales continue to feel the pinch of the ongoing COVID-19 pandemic. Community hubs have remained dormant for much of the last 18 months, and just last week, the biggest event on this community's social calendar was cancelled for the second consecutive year. Concerns regarding mental health in rural and remote Australia have only been exacerbated in recent times, but the pandemic is far from the only issue that these communities are concerned about.
Mental health needs are different.
This is Richard Colbran. He's the CEO of the New South Wales Rural Doctors Network.
The thing that I think is very important to acknowledge, though, is that access to mental health services and mental health conversations are harder to get outside of city-based areas. If you think about the last 4 or 5 years in rural New South Wales particularly, you start with drought, you then go to bushfire, you then go to a bit of flooding, you then go to COVID, you then go to mice, and the impact of rural living and the natural disasters and emergencies we faced over the last 4 or 5 years compound on top of each other.
Another statewide organisation that is committed to improving the health and well-being of rural and remote residents is the Centre for Rural and Remote Mental Health.
We know that for a long time we've seen consistently poorer rural health outcomes. That's not just mental health, that's rural health. For us, there's a keen desire to fundamentally understand what impacts rurality bring to someone's mental health, so to understand people in place. And so one of the areas around that is, advocating for and getting as best data as we can in that space. And in 2000 to 2011 or so, we were able to run ARMS, as we call it in-house. That study has been just a goldmine of information so that we could understand people's mental health in the individual, their household and their place across rural and remote settings.
Now a full decade since the Australian Rural and Remote Mental Health Study was formulated, ARMS is still assisting the evidence base of rural mental health in Australia. The events of the last 24 months have underlined how worthwhile updating ARMS could be, not only in understanding the current mental health landscape in rural and remote Australia, but also potentially establishing a longer-term outlook when it comes to improving the quality of life and health in these communities. Lauren Dempsey is one of many in the health space that believes that more targeted funding for preventative health measures will go a long way in rural and remote areas.
I think it's really important that governments especially realise the importance of preventative health and the need for more funding and support in that area. So to put money earlier on into preventative health measures, building those resilient skills and creating an environment of social connectedness can help people to not even need to access services in the first place.
A 2019 report by the Australian Institute of Health and Welfare found among several key indicators that rural and remote health was generally poorer by remoteness, similar to rural and remote mental health. While health practice has and will continue to improve with time, a consensus among health practitioners and researchers is that forward thinking and planning is required to help build the foundations for improvements to rural and remote mental health and general health more broadly. University of Melbourne professor Lisa Bourke is all too aware of the current barriers that stand in the way of improving rural and remote health, and the dilemma of attracting a sustainable workforce sits at the top of that list.
So people's first preference for employment is often not in rural or remote areas, and the more remote you go, the shorter the workforce is. So in rural Victoria we struggle, but when you go to remote NT or WA, you really see significant workforce shortage.
New South Wales Rural Doctors Network program lead Pip Kensit is currently studying medicine and has first-hand knowledge of rural and remote health pathways and the initiatives that will hopefully help improve them.
To get from studying to being a sustainable rural health practitioner, I think it's very difficult. I think that first and foremost, you need exposure. So whether you're from the country, from the city, interested or not interested, I think first and foremost, if you're interested, you should be given the opportunity. So if that is a placement or a scholarship, RDN puts together a heap of scholarships. That is providing an experience. So positive experiences are correlated with the likelihood of that person staying there, like tenfold. It's brilliant. If we can give someone a positive experience in a rural community, as in sort of a placement capacity or a rural immersion capacity, the likelihood of them considering another placement or their first job out or a job later in life is really high.
While the New South Wales Rural Doctors Network has worked to increase rural and remote pathway options, there is also an emphasis on supporting the current workforce.
With that comes the fact that a lot of junior medical officers, so junior doctors, junior nurses, because we're putting a lot of work into supporting people who are on the fence, can we convince them this is a great idea? We're forgetting to support the people who are on the ground every single day. And they're doing the hard yards and they're bloody good at their job and they love it, but they're burning out. And I think we really, really need to be careful not to push those people away.
Above all, improvement in terms of the quality of rural and remote mental health and general health more broadly is ultimately obtainable, and this will increase the chances of health practitioners seeking employment in the communities that so desperately need them. At the same time, rural and remote Australia is not an undesirable place to live and work, and this is another factor that deserves more public acknowledgement.
Is highlighting those strengths. I mean, I think there's some wonderful things about being a rural health practitioner. And we spend a lot of time lamenting the problems, but promoting some of the positives, because it is for some practitioners, it's a diverse caseload. It's the opportunity to do a whole lot of things that you wouldn't get to do in an urban area. You will find rural health practitioners that love it, that won't work anywhere else. And I think we need to get better at promoting that, because also then we'll get the right people in the right job.
If you or someone you know needs help, call Lifeline on 13 11 14.